Hi, my name is Suzanne Taylor. I'm 57 years old and I'm an executive in the car business. I've had double hip replacements within the past year and they have saved my life. Everybody used to call it my sexy limp. They're like, when are you going to get that fixed?
So Mrs. Taylor came in to us to have her hips looked at, and she had been dealing with hip issues for way too long. And it's just progressively gotten to a point where she could barely even move. She could barely walk when we started.
Dr. Culp came in to visit with me. He said, we could tell you were a hip waiting to happen. And I said, what you don't know is I'm two hips waiting to happen. He goes, we can't figure this out after we've seen the x-rays. He goes, you must have one of the highest tolerances to pain we've ever seen.
So I knew she had the personal fortitude to get through the surgical process. She was very motivated. She wanted to get back to work. She wanted to be active. Ultimately, she moved forward with her surgery as an outpatient and did really well.
The ambulatory center in Monroe is almost like having your concierge annex. It's a beautiful facility, and again, you feel like you're having direct contact with your doctors. There's only one or two patients there, so you're getting a very, very private consultation and private surgical center.
I think it's every bit as safe as being done in a hospital setting, and oftentimes more well-liked. It's a little bit more quiet there, but it's the same surgery, it's the same surgical team, it's the same physical therapist, it's the same medications and the same equipment being delivered at a different site. So I think that certainly it's something for patients to hear that is important, is that you can get the same quality or the same type of a surgery done, not just in a hospital anymore.
You're required to go to what they call a hip class. It's pretty easy once it's done, but you gotta get prepared. And that's something that they were fantastic at doing. We found out that we're going to have a nurse that's going to be assigned to you, and you're going to have a physical therapist. So they literally come the next day. They make sure that your house is also set up well, where you can do your walking, you can do your exercising. And again, it's a peace of mind that I found amazing.
So we did one hip, the one that hurt her worse, and then ultimately moved forward with the other hip a couple months later. We did a minimally invasive exposure for her hip. I used computer navigation to help guide the placement of the components. And with modern implants, you can get up and walk on them right away. So we got her up, took her to the recovery room, got her out of bed, and kind of started to test her limits. We got her walking around, got her to go up and down stairs, and she did very well with that exercise, and ultimately got to go home that day.
We did this in July. We did this one in September. I showed up at 8 o'clock in the morning. And by 1 o'clock in the afternoon, my mom and I walked up the stairs to my house. So that was one down. The second one, I was like a pro.
She came in with hips that had been completely collapsed, completely bone on bone, both sides, large bone spurs, and the ball portion of the ball and socket was completely eroded away for both hips.
Right now, I'm pain-free. I can do so many things I haven't been able to do for 4 or 5 years. The first thing they tell you is you're going to do stairs. I didn't want to look at the stairs or go up the stairs. So that to me was pretty mind-boggling. Getting in and out of the car every day. I have lost probably 10 or 15 pounds because of this also. I can walk every day. It's a game changer in my life.
Like I said, she was tough. You could see her struggling before we had surgery to get around, but I don't think she'd be the kind of person that would tell anybody that. It's hard to imagine that the person who walked in limping beforehand could walk in and just kind of flutter in here like she's completely fine. And those kind of moments really make you appreciate the opportunity to take care of people.
Now I'm outrunning everybody. They're like, slow down, come back. Where she goes. Gee, would I recommend Dr. Culp and Penn Med Princeton Medical? Here she is. I'm like the poster child for double hip replacements because how quickly and how great it was. I have zero pain in either one of my hips, and that is a miracle to me. Like I said, they saved my life.